Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dall Simons Family Studio. Glad to be with you this beautiful Friday morning. We have a busy update today. I want to make sure all of you stay with us to the very end to hear from one of our own ICU nurses who's been caring for COVID-19 patients. Bethan Piggott is her name, and I promise you will want to hear what she has to say. Also, we know that this could be a busy holiday shopping weekend. We know people, the volume has been down, people are concerned, and that all makes sense. But there are ways to stay safe, and we're going to introduce you to 4 guests who are going to tell us a little bit about how they were working to keep you safe while you shop local. And Amanda Gardner will help us answer some of our questions. But first, Hawk,
Yeah.
how are we?
We're stable right now. I think that's good rather than increasing. We have 87 acute infections with 46 of those in the ICU and 30 on the vents. So a large proportion of our ICU people are on the vents. We still have 68 in that recovery period, so it's still about 155 or so patients in the hospital for COVID. Hays, unfortunately, is still high, but a lot better than they were a week ago. So 32 total patients, 22 of those are active, and then they have 10 in the recovery period. So I think that's good that we're stable. It's a lot better than going up. As we know, as we heard a little bit earlier this morning about just decrease in testing over the past 4 days of that Thanksgiving weekend, that maybe contributed to decreased cases. But we still know definitely that peak that we saw in kansascity.com, when that looks at all of the Kansas City cases, we are still waiting for hospitalizations to be lagging behind that for 10 to 14 days. So.
Yeah, and we saw yesterday that the numbers in Kansas City popped up. They've been running around 750, and then they were back up over 1,000 yesterday of new diagnoses. And so that's a little bit of a concern. We'll see how that goes, and we won't know the Thanksgiving effect for a little while yet. So before we jump into our questions, are there any, or before we jump into our discussion and some of our discussions with some of our local merchants, are there any reporter questions?
Sure. Good morning, Cody Holyoke with Channel 9. Happy Friday.
Good morning.
I'm curious your thoughts on the CDC guidelines. I know we talked about it earlier this week, right when they were coming out, but now we're seeing, adjacent counties go different directions here. Johnson County abiding by the shorter guidelines, Wyandotte saying, no, we're going to hold it out to 14 days. Curious your thoughts on that and any potential confusion.
Okay, Hawkeye, A, it is confusing.
I would
B,
say yes.
KDHE is actually different than the CDC and different what than others are doing. So the whole thing has been shaken up a little bit about it. We spoke a little bit to this yesterday, but remind us, what do you think about the science behind the change in the guidelines?
Yeah, and I think also on the record on news stories, but off the record as far as not a recommendation, you've seen Dr. Burks calling for people to do more stringent actions anyways. The science behind this, apparently, I learned this last night, a lot of this comes from large pools of testing of especially like college athletes where they are testing frequently and other places where they are testing frequently. What they are looking at is the percent or the chance that you can spread the disease, the risk of transmission at certain time points. And that was 7 days, 10 days, 14 days. That included no testing. That included PCR testing and antigen testing. And what they found from those studies, from that data, was that if you test out at 7 days, but actually you can do the testing at 5 days, 48 hours before the end of quarantine with either PCR or antigen testing, and this is assuming a 70% sensitivity on the antigen test, that you would have a 4 to 5% overall chance or risk of spread of the disease. If you wait till that 10 days, it's down to like 1.5 essentially. So I know that anecdotally we think that's pretty dangerous because we have seen employees who have been symptomatic at day 12, so they probably would have a negative test even at day 10. But those are the guidance. And again, it is CDC, it is recommendations and guidance, and it is up to the local communities and local health departments to really go off of that and create their final recommendations. We know that, for instance, KDHE does not accept an antigen test. However, the CDC guidance says PCR or antigen test. So overall, I would agree with your first assessment of that. I think it's risky, especially now as we all predict, and there has been a lot of predictions, that these next 2 months or so are going to be very, very dangerous for the United States.
Amanda Gardner, I'm going to turn to you because you're our medical director of infection, or our director of infection control, and what do you think about these new guidelines?
Overall, I'm pretty leery of the change, and I'm actually pretty satisfied that Wyandotte County is elected to stick to the more stringent. I think that's probably the safest recommendation at this point. I understand the reasoning and the rationale behind why they've reduced the duration, but I think given what we know so far about the transmission, I think sticking to that longer time, the original timeline, is really probably what I'm hoping that we continue to do.
Okay. Yeah, my heart's with you all, because I know what my brain says when it reads the data, but my heart's like, man, I'm a little concerned. We're going into some dark times, and our athletes, a lot of it did come from sports, and I get the sports tested a lot, but there's a pretty big assumption in that, which is that the athletes are the same as a 40-year-old, a 50-year-old, and a 60-year-old. While I consider myself to be an athlete at age 60, yeah, it ain't the same as when I was 20. I'm sorry.
I think that young demographic is something.
It's a little different.
There's probably some coaches in there, but yeah, overall, it's a different demographic than the general population as well.
Okay, other questions from reporters?
Hi guys, this is Taylor at Channel 41.
Hey Taylor.
Was calling to ask about, I wanted to ask about vaccination side effects, for lack of a better term. I know a lot of us have interviewed people that have been in the trials of different companies over the last few months. I interviewed one that was in the Moderna trial, and she talked about some of the things she experienced afterwards. Do we know yet what, especially now as we get ready for people to possibly start receiving these in the next month and a half here locally, do we know yet what we can tell people to expect as far as any symptoms, side effects, anything that happens physically after they get any of these vaccinations? Is that still unclear? Do we have any understanding yet of what that might be?
Yeah, that's a great question. And remembering that when you were talking to people who were in the trial, you don't really know if they got placebo or the shot, just to be fair, or the actual vaccine. And so what I would say is this: if you get a shingle shot, if you get an influenza vaccine, you're going to have your arm sore.
Yep.
You may have chills. You may have a little fever. You may feel pretty crummy for a couple of days. And so you may have a lot of side effects. And those are the kind of side effects, because remember, we're kind of injecting an infection into your body. So you're going to feel badly, or at least some people do. So I would expect that this is the same. But to date, so far, guys, we haven't actually seen the data from the trials, right, Dana?
That's the important part. And I know everybody is waiting for that. The general public, healthcare providers, because it's important to stay informed, but we haven't seen a lot of that data yet. I assume that prior to them rolling out the actual vaccine, that data will be made available. And we heard this morning as well that the CDC will be rolling out or giving guidance for what to do after the vaccination to either healthcare workers or other people should they have symptoms, and probably what those symptoms will be. So we are still waiting for a lot of that information, and once we know that, we can certainly talk more about that.
Amanda, other thoughts you have? I mean, when we hear about this and we go to vaccinate our employees with influenza, you don't really feel good after the influenza vaccine.
Right. And I think, as Dana pointed out, we don't have a lot of the details yet, and we're really waiting for some of that guidance in regards to the logistics of how we're actually going to distribute the vaccine, and if there are side effects that we're going to have to take into consideration as we do that planning. But as you mentioned, that is the natural response after you get any kind of vaccine. You probably will have some degree of symptoms afterwards.
Yeah, I think I wouldn't be surprised, and I wouldn't be discouraged by that, because that's you should expect it, because again, the whole mechanism for this, Dana, is we're giving a little bit of an infection or some source to make your body think you have an infection so that you can make antibodies.
Yep. Yeah, you're getting foreign material in your body, and so that inflammatory process will take place, that immune process will take place to hopefully then generate that immune response, and that's what we're looking for. We're looking for both antibodies as well as T-cell responses as well.
Yeah, so I think we should expect that to happen. I think people are going to feel a little sick after they get the vaccine, and in some ways, I don't want to say it's a good thing, because you'd like to not feel sick, but it means your body's doing what it's supposed to do.
But I suspect a majority of the issues will probably just be local injection site discomfort or ache.
Yep, it's going to feel a lot like, I suspect when we see the data, it's going to look a lot like the influenza vaccination.
Vaccine,
So, other questions? All right, not hearing any. First up today, a must-have. For those of you who plan to go out to shop this weekend, you have to have a mask, and lucky for us, our first guest makes them, and he gives 100% of the proceeds to charity. A lot of charities. Matt McInnes, I hope I said that right, Matt. I apologize if I said it wrong. Matt joins us by phone. He is the owner and chief executive officer of McInnes Group Incorporated. Matt, these are great masks. I got to say, I first saw these when Mayor Lucas was on our update last week, and I thought, man, that is a good-looking mask. Hawkeye's got it well modeled right there. I'm going to put all mine in a minute as soon as I stop talking. Why did you decide to make these and donate the proceeds?
Good morning, and yes, you did say it correctly. Thank you.
Yes.
When COVID-19 first hit Kansas City, my family and I knew we wanted to give back and do something. So we decided to start making masks and T-shirts to raise money, particularly for first responders and those on the front line for the community, I was born and raised in, and it's done so much for my family.
Well, Matt, now that I've claimed my mask and nobody can wear it, so I get to keep it. And by the way, this is one of the most comfortable masks I put on, and I put on a ton of masks. Hey, you and your family know a little bit about suffering health problems. We read on your website that you suffered a widowmaker heart attack, and your wife was diagnosed with a rare cancer. That's a lot for any two people, let alone a family. How do you stay upbeat and work so hard for others?
Yeah, it's been a tough 2 years for my family. First with myself, then with my wife. But we're really trying to set an example for our daughter Finley. We're trying to teach her to be grateful, and the best way that we know how is giving to Kansas City. So it's all setting an example for our daughter, and the best way to get by hard times, we believe, is by helping others.
Yeah, well, I can't tell you how much we appreciate that, and thank you. Your masks are cool. Mayor Lucas looked really good sporting his. Yeah. Hawkeye looked great sporting his. I don't know about how I look, but but I think the mask is probably a good addition for me. So thank you so much. How do you go about getting one of these cool masks?
Okay, so we have a website. It's www.ownkc.com. That's OWNKC.com. We're also on Facebook and Instagram. But if you go onto our website, you can get masks, hats, shirts, and like you said, all the money, 100%, goes to local Kansas City charities.
Okay, well, here's to anyone in my family who are listening this morning, expect a stocking stuffer this holiday season. OwnKC.com. Matt, watch my order. There's going to be 20 or 30 of them. They're coming right up to you.
Hey, we appreciate it.
All right, let's bring in Daniel Silva, President and CEO of the KCK Chamber, and Katie Mabry Van Dieren. Okay, guys, the names this morning, really. Thank you. But hopefully I got that one right, too. Katie Mabry Van Dieren, the owner and curator of Strawberry Swing. You both are heavily involved in working to make the holidays safer and keep businesses in business. Katie, let's start with you. Tell us about what you're doing to help keep people safe and at the outdoor markets and at Union Station.
Hi, thank you so much. You all are heroes. So normally this would have been our 10th annual holiday market inside Union Station. We had 20,000 guests last year. So pivot. What we did was we worked with the Missouri Arts Council to get a COVID plan approved. And so what we've done is moved it outdoors. So we are now Kansas City's first open air holiday market. And we have gone from 160 local handmade artists to 40. And we're only allowing 150 people in at one time. And there's a capacity outdoor of 2,500. We're requiring masks. And we're even selling mask chains. These are really cool. We're also social distancing the tent. We're social distancing the line. It's ticketed per hour so that we don't have more than 150 people go in. And we're doing a health screening when they come up. They shoot a QR code with their cell phone and answer all those questions you normally answer at the doctor's office about your symptoms. And if you answer yes to any of them, we refund you and you cannot come in. So hopefully it's super safe.
Well, it sounds like you're really working hard to do it. Daniel, how important is it for us to support local merchants during this pandemic?
I think it's absolutely critical, especially during this time. We know that the pandemic has really impacted small and local businesses, and we really urge the community, if you're going to do any shopping or go out to eat, please go to local businesses during this time in a safe way.
So I'm one of those guys who likes to shop local and works hard to shop local. And I haven't been into many restaurants in the last very long period of time, 10 months or whatever it is. And but I'm doing the curbside. In fact, tonight on the way home, I'm picking up my wife and I have our Friday night dinner. We pick it up for one of the local folks and we take it home and eat it. And I think, it's so important to help each other out during this pandemic. So I so appreciate the message and that you guys are here. So thank you for all you're doing in the community to help keep folks safe when they're out and about. And if you want to hear and see the full video on the WICO pledge, we have it on our Facebook site. Wyandotte County, they've done some pretty good stuff around this whole pandemic. They've done a great job, especially because Wyandotte County, if you remember, has a lot of folks who work on the front lines, a lot of the essential healthcare workers, a lot of essential workers who are out there in the grocery stores, people who can't not go to work. And so really appreciate all the things people are doing to keep everybody safe and certainly to keep our backyard safe here in Wyandotte County for the University of Kansas Health System. So thank you guys for everything you do and thanks for helping us encourage to shop locally. Joe Gower is our last guest this morning. He is co-founder of the River North Business League, where they're taking a slightly different approach to safety and supporting local merchants. Joe, tell us about your crates.
Sure. Well, Northtown is known for its breweries and Screen Lane Armor movie theater and its local storefronts. And then COVID comes along just in time to cancel Snake Saturday Parade, which isn't just the biggest event in town. It's like Black Friday for North Kansas City. And it's looking like for a second year in a row, we'll be going without that parade, which is just devastating news for a lot of the local bars and restaurant owners here. Our organization wanted to do something notable and raise awareness for our community here in a COVID-safe manner. And so we're packing it all up in a box and bringing the party home to all the visitors around the city who are maybe otherwise staying home instead of grabbing a holiday beer with their friends at Center Block. We're offering a $50 and $100 gift box with pickup sites at the different brewery tap houses around the neighborhood. The boxes vary in price, but they'll each have some combination of 22-ounce bomber bottle release, a 6-pack, and a 32-ounce growler for refills at any of the 4 breweries in town: the Cinder Block, Big Ritz, Allsign, and Calibration. You'll also notice we've got a bottle from Restless Spirits in that photo. That's a great North Kansas City-based distillery next to Chicken and Pickle who stepped up and helped make sanitizer when there were shortages around town. And then there's the third gift box you can pick up at the Iron District's outdoor food court with pre-mixed tiki drinks for 2 from Tiki Huna and a bunch of merchandise from Iron District vendors. Each gift box will also have 2 passes to our Pine Path bicycle pub crawl that we had to bump to the spring of 2021, and a commemorative T-shirt by Northtown artist Simon Sheckles, and basically whatever other surprises we can pick up between now and then and when they actually go on sale next week.
Well, thank you, Joe, and thank you, because we understand that sales start Monday. We thank you for the work you're doing to keep folks safe. This holiday season, we know a lot of folks out there have been sick with COVID-19, and this is truly a smart, fun way to celebrate the holidays. Thank you guys so much. And I just want to say, I was born and raised here in Kansas City. This is my hometown. I was actually born and raised in Independence, Missouri. I went to McCoy Elementary School, Jim Bridger Junior High School, Truman High School, William Jewell College. I'm a Kansas City kid, and it makes me so proud to see how this city has pulled together and to try to support each other. Thank you all for the great work that you're doing. In the midst of a pandemic, the more we do together, the stronger we will be. So thank you all so much for that. Well, Jill, let's get to our questions from the community. I know we've got some really important ones today.
Sure. Let's start with question number 1. Why, when there are so many therapies to treat COVID-19 patients, are so many people still dying?
Yeah, there are a lot of people who are still dying out there, Hawk, and I think the answer is that this is a bad disease. We can think there are a lot of people, there are a lot of therapies out there to treat cancer, but people still die from cancer. There are a lot of therapies out there to treat heart attacks, and people still die from heart attacks. And I think that's really the thing. Yeah. And plus, it's been 10 months or now I guess 1 year since the virus was described from Wuhan. And the reality is, in medical time, that's like a minuscule amount of time to try and develop new therapies. So I think it's remarkable we've even got some new therapies coming.
Yeah, exactly. And I wouldn't say there are a lot of new therapies. I would say there's one therapy to use, and that's the antiviral remdesivir. The other therapies that we use, the things that we've repurposed, is the dexamethasone, which is a steroid. We also are using the anticoagulation. So at that point, we're not really treating the virus. We're treating the effects that virus has had on your body, that immune dysregulation, that inflammatory process. And that being said, just like you said, a year is a minuscule amount of time. To think that we have vaccines in less than a year, when medical therapies and vaccines, the shortest time any other vaccine has been brought to market is 4 years, and we're now looking at doing that in less than a year, is just absolutely remarkable. But there's still so much that we don't know about this virus, how it interacts with the body, although we're learning more every day. There really is one therapy, and hopefully there will be more therapies. Hopefully there will be pills that you can take as an outpatient, you can get a prescription for. But right now we have remdesivir. The other things that we use to help treat COVID-19 and its effects, again, are the dexamethasone, the steroids, to help reduce that inflammation, and the anticoagulation to try and treat those large and small blood clots that we know that occur, especially in that critical illness.
And we have bamlanivimab as well with the new monoclonal antibody, or
Yep.
Bamlan, and we have the new Regeneron product we're starting to give too. So we've given 18 doses so far. We have about 200 doses there. I've also said something yesterday I've got to correct. I said that our employees who were not our patients would not be eligible. That is incorrect. Our employees are eligible to get it here at the health system because they're frontline healthcare workers. We have to keep them healthy, and so that was the logic around that. So,
And we do have information about them as well.
yes.
So for
Yep, and so we can talk more about that. And just as another point about new therapies, remember that next week is vaccine week. So we're going to spend the entire week talking about vaccination. We expect our first shipment from Pfizer to be here December the 15th, providing that they get the EUA. So this are maybe a few days past that,
Yeah.
but right around that period. And just think, that is a remarkable statement. And the first doses from Moderna to be here around December 22nd. So, man, that is real hope right there. So instead of being sorry, Jill, I got the questions in advance. So I'm sorry,
I know.
Read it for us.
Yeah, I'm happy
Sorry about
to.
that.
Question 2. Instead of being reinfected, is it possible patients are just testing positive after no longer shedding the virus and only think they have been reinfected?
What do you guys think, Hawk? We'll start to you, and then I'm going to go back to Amanda, too.
I don't exactly understand the question, but, viruses like HIV incorporate itself into the genome, into your cells, into your DNA. We don't have any recognition of latency of this virus, that it's just incorporating into your cells. So, again, the best known evidence is that it is just shedding pieces of that virus, not the full virus, especially after you're looking at those 10 or 20 days when you could come off of isolation if you've been in the hospital, when we can remove isolation precautions because of that. So again, there's no evidence that there's any latency, there's no incorporation into your cell's genome. So it is still really felt to be just shedding of virus particles or pieces of those genomes rather than even full competent virus, especially as you're moving past that 10-day mark if you've been at home and haven't had to seek medical attention.
Amanda, there's still a lot of, we do mostly PCR testing here at the health system. Others now, you can get the home testing kits, you can mail them in, there's the antigen testing. What do you think about those tests? How confident are you in their specificity, their sensitivity, their accuracy?
Yeah, I think from a healthcare perspective, the PCR is going to be the gold standard. I think that there are still lessons to be learned from the antigen testing and the home testing. And did they do it accurately? Do you have a good specimen to actually be testing with? I think there's still a lot of false hope with that negative test, especially depending on the timeline in which it's being performed. Back to the question, and I kind of agree with Dana, I don't exactly understand what the reinfection question is speaking to, but it does bring up something that we've been dealing with here in the hospital, and also would happen if you're at home after having a positive test, is really understanding, is it an active infection? Are you truly infectious? Because we may have patients who come in and they'd had symptoms for a week or maybe even 2 weeks, but they hadn't been tested yet. And so we are erring on the side of caution and using that first positive test as we're going to go 10 days from that first positive test as that acute infection stage. But truly, they may be beyond that acute infectious stage. So it's still a lot that we have to learn, and it makes a big impact as we utilize the isolation resources and utilize our isolation units for taking care of these folks. So it I think is just another added difficulty of managing this pandemic is there's still a lot we don't know, and is there reliability in all of the different testing that is available?
I think you're exactly right, and I think you said it really well. And I think the key is that we're trying to be conservative so we keep people safe, both the patients and our staff. And as a result, we're trying to take this pretty strict, because I think you made a great point. Patients come in and they're sick and we test them and they're positive. They've been sick for 10 days. They may be at the end of their actual transmission part of their illness, where they can communicate it to others. But we're going to go ahead and put them into quarantine then for 10 to 14 days thereafter, because we mark it from the day they tested positive. And I think that could really be true. I think the other point about this reinfection, I've read this question a couple of times. I think what they're trying to ask with this is, if you've shed the virus and then you start shedding again, is it that you're just shedding it again, or that you got another infection? So do people stop and start shedding the virus from time to time? And I suppose at the tail end of this infection, that could happen. We don't really know a lot about that dynamic, though, I don't think, Hawk.
No, but we do know that you can test negative on PCRs and then the next week test positive again. So that is important to note. Again, remember—
And that may not be reinfection, which I think is what
Correct.
this listener was trying to ask.
And it's very difficult to tell reinfection. Most of the time, we're going to have to do it clinically, because the documented reinfections, they're able to have the first isolate from that first infection, do whole genome sequencing, and then have the isolate from the second infection, do whole genome sequencing. That is not very readily done and is very costly. So usually, moving forward, we really have to go on the clinical basis, especially if you're 90 days or more out from your first infection.
Will healthcare professionals be well enough to work during the couple of days after receiving the vaccine? How will the vaccinations be staggered?
All right, Amanda, this is right up to you.
Well, I think we sort of discussed this earlier when we were talking about giving the vaccine, and that anticipated response that you may have fever or chills following the vaccine being administered. I think we're still waiting on some of the granular details in regards to the allotment that we're going to receive, exactly understanding how we're going to prioritize the distribution. And I think, as I think Dana maybe mentioned before, we still have some additional guidance that we're waiting on from the CDC in regards to what to expect after the vaccine is administered. So those are things that we are incorporating into our planning. We meet on a very regular basis as we learn more to make sure that we are prepared if we do get that shipment in the next couple of weeks.
Yeah, and I think people can still, I mean, to me, and you guys weigh in here, I don't really know where it is. So I'm going to say something, you may have to correct me, okay? This is what I kind of go out on a limb, and sometimes the limb gets chopped off. So if somebody has the vaccine and then they develop a fever, are they still going to come to work the next day? And that's just not here. That could apply to anybody as we go forward in this pandemic.
So I think the answer to that question is, we're kind of anticipating that you might have a febrile response to that vaccine. So ideally, you're not coming to work if you're sick. So I think we're going to have to take into consideration, are there other symptoms that are coming along with that? And really, we do have to understand, is it vaccine related, or are they sick with something else, maybe the flu, maybe it's COVID, or some other virus that might be going around. So I think we have to take it kind of on a case-by-case basis and really understand what we're going to anticipate following the vaccine.
Yeah, it makes so much sense. And Hawkeye, have we seen any influenza yet?
No, actually looked on the CDC website the other day, and since late September to November 21st, there were almost 300,000 tests for influenza performed, and there were just under 500 positive influenza tests that have come up. So that's a very, very small percentage. Again, I would think most of those are probably antigen tests, and we know antigen tests, especially when there isn't a large prevalence of disease in the community, can have a higher rate of false positives. So it's really unclear how true those positives were as well. But in general, in the United States, overall right now, there is an extremely low amount of influenza activity.
Yeah, it's been great so far. We hope it continues that way. Wear your mask, you stay safe from influenza and COVID.
Early estimates were that 80% of the population would have zero or mild symptoms of COVID-19, with so many being hospitalized and dying. Has that percentage changed?
What do you guys think? Because I'm not sure that it was ever 80% would have zero or mild symptoms. That seems like a little higher the number than I was familiar with.
I think our wording was 80 to 85% of people will never need to seek medical care.
Yeah.
I think that still holds very true. Unfortunately, when you have 15% who need to seek medical care, whether that's just the medical surgical floor or going into the emergency department or the critical illness, that small percentage of people, when you have such a high number of infections, is a very large number, and I think
Well,
that's what we're seeing.
Well, and just think about that. Right here in Kansas City, we had 1,000 positive
Yeah.
tests. If we had 15% of those coming in, that's 150 each day. That's a lot.
Yeah.
Amanda, thoughts from your standpoint? What do you think about those stats?
Yeah, so I also wanted to add something to the previous question, and I think even if we don't exactly know the science or the implications of the vaccine on whether you're coming to work sick, I think it really just stresses the importance that just because you're vaccinated, it doesn't mean that you can't, that you still have to continue the basic infection prevention and control measures. Like, it's still critical for you to wear your mask, do good hand hygiene, and do the social distancing. In regards to the current question, I agree with you. I think we don't have, I think maybe the statistic there was a little high. I think it's also important to note, and I know this has come up on the show before, that we've had patients who are coming in with maybe their chronic illness or a different acute illness, but they've waited to come into the hospital, and perhaps that's also contributing to other reasons for mortality in the hospital setting, not just COVID, but the fact that they delayed seeking care because maybe there was a sense of being scared to come in and seek that essential medical care. And we absolutely have to correct that.
Yeah, boy, I think that is really true. You know, we saw some statistics today. It's very interesting that, for example, our medical ICU number of patients this time of year should be 40 or 45. We have 27 medical ICU patients who don't have COVID. That's really weird. Now, we have a ton that have COVID, but that's also true in the hospital, and it's true throughout the country. There's some information that was published yesterday that talked about how healthcare costs in the United States overall this year are down. In the midst of a pandemic, our overall healthcare costs are down, and it's because people aren't seeking care for their routine diseases, and I think they're partly afraid to do that. So, the long-term impacts of what this pandemic has brought for us, unless you believe that a good percentage of people who sought medical care really didn't need it, that's not true in my clinic. No. Then I would say I'm a little nervous of what were happening. I'm haunted by those words from Jamie Wagner, our breast cancer surgeon here, the other day, and talking about how many patients she's seeing right now who didn't get a mammogram and now months and months later are discovering a lump on their own, which means it's going to be a bigger problem. And so, gosh, don't forget to still go see your physician.
The diabetes didn't go away. The newfound lumps did not go away. That cough that has been persisting or getting worse didn't go away. So that's important to continue to talk with your medical teams. If you have an issue, talk with your primary care, talk with your specialist, come in and get it evaluated.
Can my bubble include my mom if she only visits me and then returns to her condo?
All right, Amanda. Well, I'm going to see how you answer this question because I'm going to tell you how I live my life.
So I think it really is a matter of, is that the only time that she's leaving, and is like she's just coming to visit you? Or, I mean, is she going to the grocery store? Is she playing bridge on the weekends with a group of friends? I think you just have to be very cognizant of what those behaviors are whenever anyone, whether it's your mom or a friend or other family member, how they interact outside of their interactions with you. And if you have a degree of trust and you know that they're always doing good social distancing, they're always wearing a mask, they're performing good hand hygiene, I think you can consider adding to your bubble. But I think you just have to be very cognizant of what those behaviors are and really have those hard discussions about what are their behaviors whenever they're not with you.
I think that's exactly right. And so, Hawk, my kids, I say they're in my bubble. They come over, and I know that they behave pretty darn well. But it doesn't. I mean, I'll be honest. It increases the risk. Now, I'm not supposed to say her age online anymore. She called me. She said, "Stephen, quit saying my age on your program." But my very spry, very wonderful 88-year-old mother-in-law, she's at Bishop Spencer Place, where they do an amazing job. I was going to say they do an amazing job. They've really done a great job around COVID. And she doesn't leave. Now, they don't want her to leave either, and they have to do quarantine if they go back. But she just stays there. And I think it's all about relative risk and how much you're willing to tolerate. And you do the very best you can while trying to maintain some aspect of your life, even in the midst of this.
And I think it depends on what your bubble is, too. If you are like the patient that we heard about that went to a large 40-plus person group gathering for Thanksgiving, then that is your bubble, and you can potentially bring risk to your loved one, your mother, into your bubble now. So.
Yeah, and some of those folks have come to see us, and we're starting to see it already. We're seeing some,
Yep.
and this is about the time you're going to start seeing it.
Yep.
We're starting to see some of the Thanksgiving gathering patients coming in. It started yesterday and last night, and I just, we hope that most people were conservative, but man, 40 plus people, and you're over my age, I don't know. I think that's a lot of risk. So.
Can I walk outside with someone who has already had COVID-19 and feel safe without my mask?
Okay, guys, I'll tell you, if I thought somebody already had COVID-19, it would say, okay, well, they've already had it, but it would all depend in my mind of how safe they practiced. I was outside, how close I was with walking to them.
Yeah.
But if I had any question, man, I'd be wearing my mask.
Yeah. I think masking is important. When did they have it? Did they have it back in April, or did they have it, 2 weeks ago or 3 weeks ago? Because I think that matters too. That goes back to the question of reinfection. We don't know what happens if you get reinfected. Are you going to have same symptoms, less symptoms, more symptoms? Can you still spread the disease? Are you going to replicate the virus in high enough titers, or is your immune system tamping it down enough? Are you going to replicate it in high enough titers that you can spread it to other people? I think if they're not normally in your household, and it's gone to household now, not just bubble, but if they're not normally in your household and it is somebody, I think being safer than not is probably the best course, wearing that mask, trying to stay separated. Even if you're outside and talking, separating by 6 feet is not really going to matter. You can still hear each other's conversation.
Amanda, what are your thoughts?
Yeah, I think this is very similar to just because you've been vaccinated doesn't mean you can't or that you can stop the infection control practices. I think just because somebody has had COVID-19 doesn't make the risk, I don't think it changes that risk factor. So I think, as Dana mentioned, if they're not in your household, I think you maintain that same level of discretion and maintain good social distancing. Wearing your mask is still going to be critically important.
Yeah, I think that makes a lot of sense. So here's my story. So last night, my dog looked at me like, come on, what are you doing here? Get off the couch. And wanted me to take a walk. So it was about 9 o'clock. I was just getting ready to sit in and watch Star Trek Discovery. Love the show. And but my dog was like, you got to take me for a walk. So I'll take the dog. We'll walk for about a mile. I didn't wear a mask. It was 9 o'clock at night. Nobody's around. I could see my breath.
Yeah.
I'm telling you, 5 to 6 feet, man. 5 to 6 feet, and I went home, and I have two posts kind of close together, about 5 feet apart. Man, I took a deep breath. It is my breath cloud 5 feet, no problem. Put a mask on. It's not going anywhere. I'm going to bring that video in so everybody gets to see it, the Steve Stites breath cloud. But I think you can go out and be safe outside, especially when you're walking with your dog at night when there's nobody else around you. You don't need to wear a mask. But I tell you, if I'm in Loose Park in the middle of a beautiful day in the afternoon, this weekend looks pretty sunny, I may go out and do that. But I'll have a mask on then because there's too many people, even outside.
Well, and with Anthony, when he got it early on, he's in our work family, but everybody still wanted to wear a mask, and him especially.
Yeah,
he didn't want to get it again.
He's still doing it. And they're back there in the control room right now with Anthony and Logan. Team, thank you all so much. They both have masks on. Now, Dana and I don't. But we're like 8 feet apart. Jill and our team, we don't have one on here, but we also have a negative airflow room. And unfortunately, we've had that theory tested here a couple of times because somebody was positive after our program. We learned later, and we've not had any other positives here. So we've tested ourselves, and actually the negative airflow room is working.
And before we move from our spots, we put our mask back on.
Yes, we do.
Last question. Our family is doing a 2-week strict quarantine to spend Christmas together indoors. Should we still mask at Christmas? We're going to be together eating and opening presents.
That's a great question. Amanda. Don't you love the way I keep coming to you first? Because I don't know the answer.
It's an easy answer for us.
Yeah.
Amanda.
Yeah.
Can you come on more often, please?
Of course. So I think if it's truly a strict 14-day quarantine, meaning that you've really limited the likelihood of any exposure to you before you're getting together with maybe folks that they're not in your household, so maybe it's your extended family. Again, I think, is there still risk? Absolutely. But is that a mitigation strategy because it is so important to you that you get together and you don't wear your mask? I think you have to take that into consideration. I think you have to have a significant amount of trust that everyone's 14-day quarantine is maybe the same, that there's not any breaches in that 14 days. And if there is, then you would hope that somebody would speak up and say, you know what, I was unable to do it because of, it is a burden. If you're still able to maintain that social distancing, I think it's still critically important, especially during the time that you're eating with one another.
Yeah,
I think so. That's kind of where I would be. All right, team. So Monday, we began our week-long, in-depth discussion on COVID-19 vaccines, from research and side effects to effectiveness and distribution. And again, folks, just to say it, science is real, science is delivering vaccines, and science is going to help us find the way out of this pandemic along with your behaviors. We have an impressive panel of guests, starting with the Chair of Internal Medicine and the Vice Chancellor for Research here at the University of Kansas, Dr. Matthias Salate, and Dr. Kevin Ault, an OBGYN and infectious disease physician and member of the CDC Advisory Committee for Immunization Practices. So next week's going to be really important, because by the next week after that, we're going to be vaccinating people. That's a big deal. So we're excited. Hey, from our team of panelists today, Amanda, final thoughts.
I think just as we started this show, that's probably a good weekend for folks to start their Christmas shopping or maybe finish their Christmas shopping. So I just encourage everyone to stay safe and maintain good social distancing, find some new and exciting masks, and carry a little hand sanitizer with you.
Hawk?
Yeah, I'd like to echo on that. We are getting closer to Christmas time. Other holidays as well. We all want to be safe for these holidays. We know it's the winter. People are meeting inside more. Continue to be vigilant. Really keep yourself, your loved ones, and your family safe. Do those things we've talked about. Not go to large gatherings. Not really interact with people outside of your household. We know it's dangerous unless you can do the distancing, the masking. Certainly outside is better than indoors.
I want to say a special thank you to everybody who participated earlier from our local businesses. This is a special deal, and these are hard times. I love shopping locally, whether it's K&K Fly Fishers. I think I manage to go there every weekend. My wife's, what can you possibly buy there anymore? I don't know. I just got to go out and hang out for a little bit. Whether it's K&K or my favorite local restaurant, Brookside Poultry or Stuff down in Brookside, there are just so many great local places to go, and so appreciate that they're taking this seriously and working with us to keep everybody safe. So that truly is the best. We said earlier in the week that dedication and devotion are part of the treatments for getting through COVID-19 safely. Dedication to the rules of infection prevention and control. Washing your hands, keeping your distance, wearing your mask, staying home if you're sick, all the things we talk about all the time. And remember those rules, travel with you wherever you go, be dedicated to them. Dedication to the pillars. It shows devotion. I think devotion is like an act of love. It's an act of caring. And I think that when we're dedicated and when we're devoted, then we work through this together. When we try to disbelieve science or politicize mask wearing, we're not really devoted to each other, because we stop telling the truth. And when you stop telling the truth, COVID reigns. COVID-19 is a serial killer. As promised earlier today, Bethan Piggott gets the final words. She's been a nurse for just 2 years. The last 8 months she has spent caring for COVID-19 patients in the ICU. She has a strong message that may be difficult to hear, but please listen. Remember and protect yourselves. COVID-19 is a viral terrorist. COVID-19 is a serial killer. You can stop it. Let's listen to what Bethan has to say.
I've put someone's mom in a body bag. I've put someone's brother in a body bag. I've put someone with a young child in a body bag. COVID is not a gift. COVID's this year's coal. People don't think it can happen to them, but it does. It's just not worth it. It's not worth it for you. It's not worth it for your family. It's not worth it for Christmas this year. I would rather see your whole family at Christmas next year than I would see your loved one in the ICU this Christmas. I tell people they're only as safe as their dumbest friend is. If I learned anything from the families, if they could take back the event that caused their loved one to get COVID, they would in a heartbeat. It hurts every single time and it doesn't get better.